Hey everyone, it's Drew. We're here at ASAP's 2017 at the IM3 booth, joined by Dr. MacLennan here. Thanks for joining us.
You're welcome.
So talk to me about ASAP's. What was one of your favorite sessions?
This is a fun meeting. I've had such a good time in the sunshine in San Diego, even though I've been inside the convention center most of the time. I've been learning a lot about body contouring and about breast surgery, as always, and also about labiaplasty. And I went to a fantastic course yesterday that I think is really going to help improve some techniques in body contouring and add some things to my abdominoplasties and mommy makeovers.
Cool. You want to give us any more details about what you learned?
Yeah, it's sort of a circumferential approach to abdominoplasty, so you're not just treating the front of the abdomen, you're really sculpting a waist and treating the whole area as opposed to just tightening up the skin of the front of the abdomen.
Okay, cool. Sounds awesome. So this is the 50th anniversary of ASAP's. Can you tell, you've been a member for a little while now, right?
I've actually only been a member since 2014. I'm a relatively new member, even though I've been in practice for a lot longer than that. So, it's a good addition to my practice. The educational opportunities with this society are fantastic for my practice, cool. And it's been a fun meeting.
Great. Why don't we talk a little bit about kind of the there's so much evolution in medicine, like there is in a lot of industries, but I feel like in this particular, with the minimally invasive, non-invasive, it's kind of skyrocketing. Talk to me a little bit about how that evolution is taking place, and then maybe where this goes in the next 10 years as far as non-invasive stuff.
Right. Well, it's interesting because our practice has traditionally been a practice that has focused almost entirely on surgery. But just recently, in the last year, we have embraced a couple of non-invasive technologies, and we watch them carefully. We don't want to have a million machines. We're still surgeons at heart, but we think that some of the non-invasive techniques and devices can be a nice adjunct to our practice. So we do think that Coolsculpting is a great option and can be a great adjunct to our practice and a good option for women who aren't necessarily interested in the recovery of surgery. And we also are really excited about Miradry, which can eliminate problematic sweating for people, for men and women who have a problem with that.
So I talked to Miradry yesterday, and they were telling me right now it's just under the armpits. Yep. They're talking about looking at different areas that they can actually use the technology as well. So that's pretty cool.
Yeah, so we'll have to watch that, and our Miradry practice has certainly been increasing.
Cool, awesome, good stuff. All right, well, I'm just going to ask you some rapid fire fun questions, learn a little more about you, put you on the spot here for a little bit, okay? What's your favorite color?
My favorite color is pink.
Yes. Favorite sport?
My favorite sport is rowing.
Rowing? Interesting.
But skiing, too. I live in the mountains, and I love to ski.
Are you a rower?
I was a competitive rower in college and medical school.
That's crew, right? Like crew team? No kidding.
I always say it's the sport for failed basketball players because I'm 6 feet tall, but I'm a terrible ball sport player.
Do you have to be tall? Is it because of the leverage?
You're better with the lever, yeah.
Where did you go to college?
Dartmouth in New Hampshire, yeah.
And you were on the crew team at Dartmouth?
Yeah.
That is amazing.
Yeah.
That is so cool. Yeah. Awesome. Do you have any children?
I do. I have an 8-year-old daughter and an 11-year-old daughter.
Awesome. Which one's your favorite?
I can't tell you that.
That's my favorite question to ask.
And I have a beloved golden retriever.
Aw. I have a miniature pinscher chihuahua.
Oh,
she's
cute.
my 4-legged daughter.
My husband sent me a picture of my golden retriever lying on the stone floor right in front of the front door waiting for me last night.
I'm sure. My first dog I ever had was a golden retriever.
Aww.
Booker was his name. I wish he was still here. Anyway, any advice you would give to a previous boss?
Pass.
Okay. Fair enough. Why did you get into plastic surgery?
I'm a plastic surgeon thanks to my dear friend Tom Huntsman in Cooperstown, New York at Mary Imogene Bassett Hospital. I went to do a rotation with him as a medical student. I thought I was going to be a medical oncologist. I really liked cancer and cancer chemotherapy, therapeutics, etc. And I went to do this rotation with him because it was part of what I needed to do for medical school. And the first day, the first case, I did a breast reduction with him, and I said, this is what I want to do.
Awesome. That's a beautiful story. What were you like in high school?
I was kind of a nerd, and I played the French horn,
Awesome.
And music was my life.
Nice. Yeah. My next question was going to be, do you have any unique talent? So it sounds like music is a talent of yours.
Well, my unique talent at the moment is that I love to Irish dance.
You're kidding me.
I take adult Irish dance class every week. Yes, no arms.
No way.
Hard shoes, river dance.
I can kind of do that, by the way.
If I ever lose my career in plastic surgery, I cannot join roommates, no. But I love tire stands. It's a strange little factoid.
Are you on camera anywhere doing this?
Not as far as you know.
I'm going to find one. I want to see this. All right, what's your biggest fear?
Oh, you scared that one right out of me. My biggest fear is that my children will not be happy.
What do you love most about your job?
It's really fun, and I love the interaction with patients. I love to operate, and I love happy patients afterwards, and that I have helped them. Sounds really trite, but it's the truth.
No, yeah. Absolutely. Favorite movie?
The Princess Bride.
Really? I think that's one of my wife's favorite movies, too. It's actually pretty good. Is that the one with...
As you wish. That one.
Yes, exactly. No, who was the actress in it?
Robin Wright Penn, I think.
Okay.
Maybe before she was Robin Wright Penn.
Okay.
Yeah.
Okay, right-handed or left-handed?
I'm right-handed.
Nice.
There's a disproportionate number of left-handed surgeons, but I am not one of them.
Really? So there's more left-handed?
There are a lot of, like a disproportionate number of surgeons are left-handed. It's not
Really?
that more surgeons are left-handed,
Yeah.
but compared to the general population.
Gotcha.
A lot of
I wonder
left-handed
why
surgeons.
that is. Interesting.
They all claim they're smarter. I don't know.
I've heard that one too. Last question. If you could be any animal, what animal would you be?
I would be a golden retriever.
Oh,
They
sweet.
have a good life.
They do. They do. All right. Well, thank you for joining us.
Thank you.
Appreciate it. Have a
Okay.
good rest of your show.
Thanks.